Welcome back. You're still watching Your Story. At least 4,000 TB patients in the Northern Cape are unaccounted for and cannot be traced by the Provincial Department of Health. There are reportedly more than 80,000 missing TB patients in South Africa, of which 4,189 are missing in the Northern Cape. The numbers were reflected in the department's first quarterly report for 2018 to 2019, as our reporter Neo Bodumela has more for us.
We have confirmed with the Department of Health that about 4,000 TB patients have currently gone under the radar, and the fact is that the department had tracer teams to take care of TB patients across the Northern Cape, but these tracer teams are no longer in the employ of the department. Now this comes from the department's 2018-2019 first quarterly report. But I have now with me Lebohang Majaha of the department, who's going to tell us a little bit more about the situation. Lebohang, what has happened to these 4,000 patients?
Good morning to you first and the viewers. As custodians of health in the province, we are guided by legal prescriptions defined by the different pieces of legislations. Amongst others is with the Constitution and other that governs the national health systems. Now, as a department, we've always maintained transparency and accountability, particularly to ensure that from time to time we appraise our oversight bodies, health stakeholders, and the public, general public, in terms of the delivery, how far we go in relation to delivering the quality of healthcare services in our province. Now, emanating from the national strategy for finding missing patients on TB, we've also depicted the picture during the start of the financial year, in the end of the first quarter, in the report that was formulated and submitted to the Portfolio Committee of Health in the province. We've also, among others, highlighted that there was a study that was conducted, particularly where a presentation was made, and also from that presentation to depict that from the Northern Cape and countrywide, if I may to start with that part, that there are over 80,000 of the TB patients that are missing, but not necessarily meaning that they can't be traced. It was just the integrated program of action that was formulated from in relation to the strategy that was informed to say, as Northern Cape, we are just affected with a mere 3%, of which is close to just slightly above 4,000 TB patients that we needed to trace.
But Lebohang, 4,000 patients, it's still a lot of patients, don't you think, that are untraceable right now in the Northern Cape? That's still a lot.
I believe if you have followed closely what MEC Makatung tangible strategies that she employed, it was to say that as a department in the new financial year, they need to reach an annual target of about screening about over slightly above 1.5 million of the people across the province, so that in relation to TB cases and so forth, so that we are able to pick up from those cases. But I can simply give a clarity to say from to date, since the start of the financial year, we've screened just over 400,000 people across the province, and out of that number, I can just simply reflect to say we have just slightly over 2,000 patients that we have picked up that were TB confirmed, and we have also administered treatment to date, and just around in the province we have close to just over about 3,000 of the patients that are currently on treatment.
But Lebohang, what are the specific strategies that the department is looking at? We can say that there are strategies, but what are the exact strategies that the department is looking at to find these 4,000 patients?
Obviously, you'll remember that 2 months ago we have launched as a department the Bedacolin TB expansion treatment, which obviously to date we have registered over 74 patients on the program, and obviously that program is it's an injection-free treatment, because it also encourages some of the TB patients just to at least try and get to the treatment. So what we are saying as a department, that there are a number of strategies that we have employed. With us planning around the board strategy, which obviously is due to be finalized at national, which for us it's a best strategy that encompasses issues of TB tracing that will be manhandled at that level. So we as a department, we are going to deal with those minor ailments on health, especially in terms of addressing issues at local level.
And in terms of the community of the Northern Cape, do they have a reason to panic, or is this a crisis for the department?
Obviously, we understand at times because we are custodians of health. We speak on issues in relation to health because we have the better knowledge in terms of what's happening. So the unnecessary call that was made by the DA, it's not informed. It's informed by absolute nothing, if I need to put it as such, because they are trying to create panic which is not there. We don't have a crisis as a department. We have tangible strategies that we have informed, that we have employed to date, and those strategies are working quite well because our people are responding to treatment, and obviously we are continuing with the health screenings across the province.
Well, there you have it. The Department of Health saying that they are working on a strategy in order to find these 4,000 patients, and telling the Northern Cape community that there is no reason to panic.
All right, well, there you have it. That's our reporter, Neo Bodumela, from Kimberley in the Northern Cape then. Calm has been restored in East London following the unrest between different taxi associations today. It's alleged that